What the health?
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 The impact of humanity on our planet has begun a new era for life on Earth. It is now abundantly clear that climate change is having a devastating effect on the health of people around the world, especially in the most vulnerable communities. We've produced this short video to highlight the devastating effects that climate change is already having on human health and the significant benefits to health of rapid action to reduce climate change. Bringing together institutions from around the world, we outlined the critical role for public health professionals and organizations to mobilize action on climate change, protecting our planet and fulfilling our duty to improve human health and well-being.
Right now, we're seeing how climate change is worsening heat stress, wildfires, and the air pollution that comes from them, and severe storms and flooding. These can worsen heart and lung diseases, harm the brain and impair children's development, and also they have long-lasting mental health consequences, including depression. Climate change is also causing changes in our natural environment, and these can contribute to the spread of vector-borne diseases. They can decrease the nutritional value of certain crops, and also ultimately lead to the loss of clean water supplies. The list goes on, but the facts are clear. Climate change negatively and severely impacts our physical and mental health. All people are feeling the effects of climate change, but not all are bearing equal burdens. People with fewer resources or those who have suffered from historic discrimination have greater risks of illness from exposure to heat and air pollution and of loss of their homes and livelihoods.
So if we think about what are the basics of human health, it's the air we breathe, the clean water that we drink, the food we eat and the micronutrient content of that food, the materials, the things we build with, the things we fuel things with, even the cultural heritage and spiritual values. All of these things that underpin human health, our physical and our mental health and our well-being, are for the most part provided by nature to people for free. The total value of this natural capital is estimated to be more than double the total economic output of the entire world each year. Climate change is set to reshape not just our exposure to climatic risks, but also the myriad interactions we have with and our deep reliance on biodiversity writ large. And it's for this reason that climate change is increasingly being recognized as the biggest global health challenge of the 21st century.
So, we're all aware that Bangladesh is particularly vulnerable to the impacts of climate change. Floods, cyclones, and other environmental disasters linked to climate change are threatening the lives and the futures of many people living here. The 40 million people living in the coastal region are particularly in the forefront of climate change and natural disasters. Water salinity has contaminated the domestic ponds, rivers, and groundwater, which communities rely on for drinking, cooking, and agriculture. In the last 25 years, salinity has increased around 26% in the country, spreading into non-coastal areas as well. And this gradual salinity intrusion into the coast is threatening the primary production system, coastal biodiversity, and human health. A population based study conducted in Bangladesh's coastal areas found that the estimated salt intake from drinking water in pregnant women far exceeded the recommended limits.
There is absolutely no doubt that climate change is one of the major public health challenges that we face in the world today, and that our health is already being impacted. No one anywhere is immune to the effects of climate change.
The good news is that as soon as we take action on climate change, we can start to improve people's health. For example, reducing fossil fuel combustion will not only help limit the severity of climate change, it will also reduce deadly air pollution and ultimately avoid millions of deaths. Our new Office of Climate Change and Health Equity is committing to reduce the health risks of climate change in the United States, especially for those bearing the greatest burden of health disparities now.
Often, when we're talking about climate change, the focus is on the bad things that can happen if we do nothing, instead of emphasizing the good things that could happen if we take climate action, like cleaner air to breathe. The new World Health Organization guidelines have shown that we're all at risk from air pollution, no matter where we live on the planet. And the Global Burden of Disease Study has estimated that more than 4 million needless deaths are caused by air pollution globally each year. Studies have shown, however, that when we clean the air, the adverse health impacts of air pollution also go down. So when we talk about the sources of this air pollution or climate change, the major causes are actually one and the same: fossil fuel burning, including coal, oil, diesel, and natural gas combustion. So when your community reduces fossil fuel combustion for climate mitigation, you'll also breathe cleaner air and reap those health benefits locally and immediately. In addition, when we control these climate change causing pollution sources, the monetary valuation of the cleaner air health benefits more than offsets the cost of the cleanup. These clean air benefits are one reason that the Lancet Commission has declared that climate change action represents the greatest public health opportunity of the 21st century.
Health should be seen as a game changer for mitigation, because a stronger mitigation leads to healthier environments. And of course, it decreases health incidences related to climate sensitivities like asthma, would decrease the incidence of diarrheal diseases because there'll be less frequent flooding that will contaminate water and bring about diarrhea. Decrease morbidity and mortality related to cardiovascular accidents because of heat waves and a lot of other things. In this regard, it will also decrease the expenditure of all governments related to the health sector. And depending on which side of the globe you come from, this budget may be really huge. Savings of this kind can be used to deal with other developmental issues.
The COVID pandemic has demonstrated very clearly the extensive impact that threats to health can have on our lives, on our society, and our economy. And it has also demonstrated that to tackle these threats, global efforts and collaboration are very much needed.
Through the role in protecting and improving health, national public health institutes have a unique contribution to make in research, in policy making, and in practical implementation of interventions. This is why I AMFE believe that national public health institutes have a unique contribution to make in addressing climate change. Their involvement in adaptation and mitigation strategies and involvement in the policy making and planning around the implementation of those strategies is a crucial contribution to countries' work and to global work in addressing climate change. This is, of course, all multi-sectorial, and no one institution or one country on their own can make a difference. The network that IAMFE represent together could make a wider contribution, and IAMFE would very strongly commend to national governments involving the National Public Health Institutes in working on this most crucial public health priority.
It is critical that health is seen as the center of the climate change discourse, because it puts a human face on the negotiations that we're having.
We young leaders from all over the world ask to policymakers to treat this crisis as it is, as a crisis. We ask net zero emission by 2030, because climate change is an existential crisis, and if we don't act right now, there will be no future waiting for us.
What is absolutely clear is that the health impact of climate change is profound. COP26 is essential to help us secure global action, and it is key that health is at the core of those conversations.
Throughout history, there have been moments when we've set aside our differences, devised ingenious solutions, and gone beyond what anybody thought was possible. This is one of those moments. Join us to pioneer a new era of public health with climate change at its core.